Hey everybody, this is John here. I'm going to give an honest assessment of my experience at Aspen Dental. It's not a paid commercial, or the video quality would be much better. Uh, I had some issues with my teeth due to years of neglect and my fear of dentists. I mean, I am a absolute chicken nugget when it comes to dentists. Um, for lack of a better term. So I went to Aspen Dental here in Augusta, Georgia. Main reason I decided to go there was because their offer of initial exam and X-ray for free. And keep in mind that this alone is going to save you and or your insurance company in the neighborhood of about $300 or so. Also, whether or not you have insurance, they have multiple financing options at reasonable rates. So that they will do everything they can to work with you. Highly recommended. My work involved multiple teeth that involved various levels of disrepair, to say the least. Also had two torics, otherwise known in multiples as tori. And if you know what that is, it's a extra bone in your gums or mouth, similar to bone spurs. Um, and they're very uncomfortable when you're eating crunchy foods. And I love my tacos and Doritos. They can also make it very uncomfortable, very painful when you're having dental X-rays. So, my initial exam, the dentist, Dr. Patel, she was a real sweetheart. Um, there's no other way to put it. There was no air of judgment because of my neglecting my teeth, and she made me feel very much at ease when explaining my treatment options. The first option was an array of root canals, crowns, dental implants, bridge work. Not going to happen with this boy. No way in hell. Um, the second option was a removal of my remaining teeth as well as a tori removal and full upper and lower dentures. Now, because of the difference in price, I chose the latter option. And she was very thorough in explaining the work that would be done and what to expect during the surgery as well as the post op recovery period. And once again, for a chicken nugget like me, this was music to my ears and made me feel very much at ease. I then spoke with the financial counselor. The first gentleman I spoke with was Matt. Um, and later on, I spoke to the office manager. I believe her name was Alicia. Forgive me if I'm wrong, but just discuss the cost of financing options. And they worked directly with my insurance company and Dental First, the financing company, to work out a deal was very much in line with what I could reasonably afford, and I would greatly appreciate it. Next step was to make impressions of my dentures, and when the wax mold was ready, I went back to get a preview of what they would look like in my mouth. And I was very impressed, and I think the gentleman's name is Drew. Um, Good job, man. Excellent, excellent work. Finally, the day came to have the work done, and man, I was not happy about being awake during the surgery. I wanted to go with the conscious sedation, but the cost is just unbelievable. I mean, it doesn't matter where you go; it's all the same. For me, it would have probably been in the neighborhood of about an extra $1,000, and yeah, I'm not Donald Trump, so I didn't have that laying around. So what the hell? There's my cat buddy trying to get in on it. So I went with the local anesthetic, which meant I was awake during the whole procedure. Um, but I was assured that I wouldn't feel anything except the pressure. They numbed me up so well that I felt no pain at all, except the needle when it went in, and that was just a little stick and burn, and very little of the pressure. I mean, almost none at all. The work was estimated to take approximately 2 to 2.5 hours, and the surgeon, uh, Doctor, I can't Kirill Cherry. I'm sorry if I pronounced it wrong. um, and he and his assistant began at about 2:30, and at about 4:20, I was on my way home with prescriptions for um, I believe it's called Norco, um, amoxicillin, a antibiotic, prescription strength ibuprofen, and a Medrol, which is a steroid. Um, and this is one of those where you have to, the first day you take 7 of them, second day you take 6, then you're going down the line until the last day when you take 1. Um, Taking that stuff, I understand what athletes like about steroids because they make you feel like Superman or whatever. I got home about 5:30, took a dose of each, and just wanted to be prepared for when that numbness went away. And at about 7:30, it broke loose. The numbness had worn off, and the pain was it was incredible. It was about a 7 out of a 10. So I took another hydrocodone and ibuprofen long before I was supposed to, but what was I going to do is either that or cry like a little baby. I mean, it was bad. It hurt really bad. So I did that. And when I woke up the next morning, I was shocked because the pain had subsided immensely. And at that point, I was experiencing a pain level of about a 3 out of maybe 10. And that was mostly where the tori was removed. As the day wore on, the pain level went down considerably, and with a minimal need for pain meds. And naturally, the swelling is still there, but with the use of the steroids and the ice pack, that's gone down considerably as well. Now on to the eating. Now, I like to eat. Anybody who knows me, I like to eat. But right now, I'm able to very easily tolerate soups with no meats or veggies, grits, oatmeal, scrambled eggs, pancakes, ice cream. My favorite is coffee. Oh, yeah. Milkshakes without a straw. You don't want to drink it with a straw because it doesn't allow the blood clots to form. And when you do that, you run the risk of what they call it, dry socket. I've had one before, and let me tell you, woof, you don't want one of them, man. Believe me. Yeah, basically, you're just chewing is out of the question for the time being. So, soft foods are essential as you need to stick to something that you can mash up between your tongue and the roof of your mouth. Um, in preparation for the surgery, I watched several videos on a tour I removed, and I saw some real horror stories, man. I guess everybody has different levels of pain tolerance. Mine is very low, but I think the reason I'm doing as well as I am is because of both the medicine and the methods they use at Aspen Dental for making mine a not so bad experience. I mean, really. In closing, I'd like to say that in my lifetime, I've been to some dentists who are really decent, and then I've been to some that range from indifferent to bordering on sadistic as far as their chairside manner. The staff at Aspen Dental were amazing, man, and they truly care about their patients, and they want you to feel as at ease as possible. And their motto is that every smile deserves a second chance, and they back it up with first class care. They really do. If you need any dental work and there is an Aspen Dental in your area, then I highly recommend them, as they certainly restore my confidence and made me a happy boy once again. So, see? Okay, if you have any questions, just post them here and I'll get back to you as soon as I can. Take care and thanks.